I'm delighted and honored to welcome Dr. Harvinder Singh Sahota. Dr. Sahota is well known in the US and across the world, and he is the bio-inventor of the Angioplasty Perfusion Balloon. He holds 30 patents to his name. So please welcome Dr. Sahota, a cardiologist and a benefactor of many philanthropic nonprofit organizations.
Thank you. What I'm going to present today is based on my 7 years in England and 1 year in Canada. I traveled all over Soviet Union, all over Europe, South America, and in this country since 1974. And I'm interested in learning about the basic things. I watch and read news 3-4 hours every day from several different sources. So all these things are collected. I watch the German news, the French news, the BBC, and the Chinese news. I don't depend on CNN and Fox that much. So what I'm going to talk to today is to see the changes in this country in the practice of medicine. And many of you know, but may not know all aspects and how much it has changed in this country. Some of us are still thinking it's the same country and same medicine which was practiced here in 1950s, 60s, 70s, 80s, but things have changed tremendously. And it is not to influence anybody and not to discourage anybody to do anything, but it's good to know the facts and what people are getting into when they go for medicine in this country. Good and noble profession because of this thing. It's getting better with the modern technology, drugs, medicines. But before getting into medicine, especially in this country, what I'm going to say is mostly applies in this country, not in other countries. Every country is different. As I said, I have seen it in all over the world. And so many times people ask me, Dr. Sahota, my son or daughter is going into medicine. Do you have advice? I said, yes. Number one question is ask him or her, why does they want to go into medicine? If the answer is money in USA, then consider this. The average take-home income today of the doctor in this country is about $10 to $25 per hour. If somebody is interested, later on I can show you the whole mathematics and how this was detected. But this is a fact. Some doctors may be making more money because they work umpteen number of hours, day and night, weekend, holidays. I don't think very many doctors sitting over here who are in practice in this country because they are attending emergency, running around in the hospital, making rounds. So as the income came down over here in this country, mainly because I think the turning point was 1980. And what happened in 1980 was the HMO insurance companies came. And that changed the practice of medicine in this country completely. Until then, it was different because the insurance companies, in 1980, the HMOs, and slowly, they changed the practice of medicine in this country. It was not Obamacare, as many people think, or any other care, but it was the HMO insurance companies. So doctors try to compensate by seeing more patients, more volume, and doing more procedures, and that doesn't justify seeing the patient if you are with the patient only for 4 or 5 minutes. And that's one of the basic complaint of the patients in this country today, that my doctor doesn't spend time, doesn't answer the questions. Why? Because he has to see 50, 60 patients every day in order to make some money and live. And of course, when they're doing too many procedures, unnecessary procedures, without any indication, because the money, then of course, sometimes they're caught also, and many times that doctors in this country, then they have to go to jail. Now, 9 out of 10 doctors do not recommend their children to become doctors in this country. Who are these 9, 10 doctors? The local white American doctors, not the foreign doctors, not the Indians. Okay, then there's a myth going on over here for one reason or the other that there's a shortage of doctors. Not at all. There may be shortage of doctors, or there was shortage of doctors in the Iowa field, farms, isolated area, Nebraska, or Wisconsin, that kind of area, but there also they are filling up very quickly because a lot of foreign doctors are coming up and they can't get places in these California or New York and that kind of thing, so they have to go somewhere, so they are filling up, and also this country has a very nice way of reducing some of the shortage, take care of these problems by incentivizing that if the doctors come from India, doesn't have a green card, if he goes and work in those places for 5 years, they will give him a green card and they're standing in line. And also the reason the demand for physicians have gone down here, too many doctors are not needed, because more and more work is done by physician assistant, nurse practitioner, maids, and robots. Time may be coming that the doctor is sitting in London and doing the surgery over here. And the nurse practitioner, there have been a lot of argument going on back and forth. I think it was California and other places that the nurse practitioner, the hospital wanted the nurse practitioner to give the anesthesia, and the anesthesiologist did not want them to give the anesthesia independently because it will affect their living. So finally the nurses won, and now it's the nurse practitioner independently giving anesthesia and replacing the anesthesiologist. So the demand is going down because of all these things. Today, if a group of doctors wants to hire a new doctor, they are likely to get a physician assistant, which will cost them half the price of getting another doctor. So doctor shortage, doctor demands is decreasing in this country. The other problem which has creeped up into this because the HM insurance company is that every doctor have to spend 2-3 hours on the paperwork. It may not be correct for Dr. Anand because he is working in Stanford, but average doctor practicing in the country, they have to take care of so much paperwork. It's unbelievable. And instead of seeing patients during those 2-3 hours, they have to complete the paperwork. Without that, they cannot be billed or cannot have license or work. This is another reason that the doctors are not needed that much because of the technology advancement, telemedicine, and somebody just mentioned that it may be through the video. There is a WebMD, everybody goes to the web, find out what is wrong with that and treat themselves. TV ads, there are TV doctors. Every TV station has their own doctor and they talk. And Jyotish, yeah. So these are some of the factors that doctors are not needed, and there's no shortage. There's not going to be shortage. This is decreasing all the time. And so slowly, these things are replacing the doctors. This is another reason doctors are not needed. The latest is from last month in one state, one city, the Rite Aid, other pharmacies are hiring the physician assistant and medical assistant, that nurse practitioner. They're sitting over there and the patients go there anytime and they treat them and send them home. So doctors are not needed. Believe it or not, doctors are being laid off in this country today. What happens is these HMOs, they are mainly for the money in that. So they will go to a group of doctors. They will say, okay, reduce your fees and we'll send you the more volume, all our patients covered by our insurance. And so let us say 5 doctors are looking after all their patients. This time they give it to one group, one doctor, and all other 4 will be sent a letter that they don't need them anymore. It happened to us last week. So it's a fact. And it was in the newspapers also that this is how HMO insurance companies are going on. And the bottom line is the money. Now, I will tell you what this is. About 15 years ago, I was sitting in a doctor's dining room, and next to me was the American white doctor sitting, whom I knew for a long time. We have been working together. So these changes were going on, HMOs. So I asked him, I said, hey, why you guys are leaving medicine and not sending your children into medicine? Is it the money? He said, Dr. Sahota, is not the money. Money is important and we like money. Everybody likes money, but it's not the money. I said, then what is it? They said, I spent 30 years of my life learning, training, medicines, even more, spent so much money and took loans and that kind of thing. And now I spend half an hour, 1 hour with a patient, take the history examination, and then I say, I want to do this test, and they say, no, you can't do it. I cannot order and get it done. Why? Because the insurance company says first apply for the permission, and then they will see if when they give the permission in writing to the doctor, only then they can do those tests. So he said, that's exactly his word. Although in the English language it's called authorization, but he said that's an insult to us. I haven't heard this thing from any foreign doctors, only the local doctors, and that's why they say we want to get out of medicine and we don't want to send our children because we feel insulted that after all that said and done and training that we have to get some clerk sitting in an ivory tower, that we have to get that person's permission to do the test needed. Now, I think sometimes we don't realize medicine, especially in this country. First of all, even when doctor is home sleeping, he's still working. It's like a firefighters. When there's no fire, they're still working because they can't move out, they're on call. Same with the policeman. Same way the doctors, even if they're at home. So even when they're home, emergency comes, the phone rings, or nurse calls, that such and such patient is not sleeping, having a problem. When that phone rings, the whole family wake up. So it's not just the doctor alone, and the whole family has to sacrifice. Now, let us say it happened to me also. You are going with the family to attend somebody's birthday or some function or party. In the middle, the beeper rings and they say there's an emergency. Even I have to turn around, go home, leave the family there, go and attend that emergency. So it's not just the doctor alone, and even the family is involved and have to make sacrifices, especially if the husband and wife are both doctors. Then you can imagine is that everything is doubled up. Now, stress is becoming very important in the medical science. I used to give lectures even in India, Moscow, Russia, everywhere, the risk factors for cardiology diseases, and I used to say genetic, smoking, high blood pressure, diabetes, and cholesterol and other things. But now, since last 5-6 years, I will replace the number 2 is not smoking, number 2 thing is stress. And the stress is responsible for a lot of diseases, makes it even worse. And the stress comes in a lot of shape and form, like family problems, financial problems, job problems, health problems, but more recently reported in the cardiology medical journals that the maximum stress comes around by driving around in Los Angeles, New York, Chicago, and probably San Francisco also. So stress is everywhere. We may realize or may not realize. When I say any stress, no, I don't have the stress. They don't know what stress is. So stress in the medicine, doctors, many of them then go on to drugs. Divorces are there because of the medical practice. Marital problems are there. Over 250 doctors in this country every year commit suicide. Very few people know it. And why not the stress? What causes the stress in medical practice? These are the things. Some of you, if know these things, these are those paperwork, these are the stress-causing thing every day, new rule, regulation by the insurance companies, by the state, by the federal government. No need to know the detail of those things, but there are EHR, EMR, PQRS, MIPS, MSO, ACA, AHA, CD10 insurance audits are there, and other rules, regulation. Do you have to deal with these? Okay. Now, in the medical journals and medical news and magazines, these are some of the comments coming up by the physician, doctors practicing these days in this country, that I don't enjoy being a doctor anymore. I don't live being a doctor anymore. Worry about paying college debts doesn't help. So all these things. Thank you. By the way, yeah, there may not be shortage of doctors in this country, but there are 800,000 doctors are needed in India today. Sardar Montek Singh probably knows that. Yeah, 800,000 doctors. If there is no shortage and doctors are needed, it's India, not here. And in India, there's no limit, there's no HMO, there's no insurance, there are no rules, regulation. And there is no stress. They say in India, doctors are doing